Okay, so, oh, sorry, some few more folks. All right, so before we get started, I just wanted to quickly say hello and welcome to everyone, both the attendees and the speakers. Thank you so much for being here. My name is Crystal, and I am one of the co-chairs on the Student SIG, along with Emma and Emily, who I will introduce here shortly. Um, but just wanted to give a few details about the format of the open house. We're just going to start with short introductions. We'll jump into some lab presentations, and then we'll split up into breakout rooms where you can just feel free to move in and out of any room that you want to get your questions answered. Once you feel you've gotten your questions answered, you can feel free to say goodbye or stick around until the end. But yes, just wanted to say hello. Again, my name is Crystal, part of the student SIG here and a rising second year at Duke University. I'll go ahead and popcorn it over to Emily to quickly introduce herself.
Thanks, Crystal. Hi, everyone. Welcome. My name is Emily Hirsch. I am one of the co-chairs of the Society for Digital Mental Health Student and Trainee SIG. I'm a rising fourth-year clinical psychology PhD student at UMass Boston, working with Dr. Jane Rhodes. And I'll pass it to Emma.
Hi, everyone. I am Emma. I'm one of the student co-chairs of the Student SIG. I'm also the student representative for the Society for Digital Mental Health. And I am also a rising fourth year working with Dr. Bethany Teachman at the University of Virginia.
Perfect. And we can popcorn it over to the speakers. Yama, do you want to quickly introduce yourself?
Yeah, absolutely. So, hi everyone, my name is Yama Chang. I'm the first year PhD student in the quantitative biomedical science program at Dartmouth College. I have a background in clinical psychology and data science, and I've always been interested in using digital mental health to do like a better prediction and intervention in depression. So that's why I came to Dartmouth. Should I popcorn to someone?
Yes, perfect.
Okay, I'll have to popcorn to Sukriti.
Yeah, thanks, Yama. Hi, everyone. I'm Sukriti. I am a rising third-year PhD student, also in the same program as Yama, Quantitative Biomedical Science, also known as QBS, here at Dartmouth College. We are both in Nicholas Jacobson's lab, which we will talk about in a minute here. And yeah, my background's actually in bioengineering and neuroscience, but I sort of pivoted over to the clinical like psych and computational world. And yeah, really happy to be here.
Perfect. And Taun?
Hello, everyone. My name is Daeun Yoo, and I'm PhD student at University of Washington, and I'm studying human-computer interaction, specifically how people interact with AI or generative AI technology. So my background was art and design when I was undergrad student, but after I realized that the art and design can make some positive impact on our everyday lives, I wanted to a little bit more focus on academic research, whether those kinds of things can be really make some positive impact on people's emotional and mental well-being. So that's the reason why I started to research in this field.
Awesome. Thank you so much, everyone. We'll jump into some lab presentations here. Emma, do you want to go ahead and take it away?
Yes, indeed. Thank you so much, Crystal. And I will be relatively brief here to make sure we can maximize all of the time for Q&As. I'll just go ahead and share my screen. 1 second. Okay, bear with my lack of PowerPoint knowledge while I try to get this going in actual slideshow. There we go. No one presenter view. Sorry. Give me a second. Play from start. Okay. So hi everyone. As I said, my name is Emma Wolfe. I'm a rising fourth year clinical psychology PhD student at the University of Virginia, working with Dr. Bethany Teachman in the program for anxiety, cognition, and treatment. As you can see here, we are a little bit of a silly lab. We have a very positive and kind of fun and goofy culture, very much led by our PI, Bethany Teachman. This is our annual April Fool's Day party that we have every year in the lab. We are a semi-large graduate lab. We have currently, gosh, I'm gonna get this wrong, but I think 7 graduate students, and we generally have about 15, anywhere in the range of 15 to 20 undergraduate students that work in our lab on during any given year. So we are a pretty large lab. But that sort of goes along with the large number of projects that we generally have going at any given time. So in this presentation today, I'll talk you just a bit through sort of what are some of the ongoing presentations, ongoing studies in the lab, what is sort of our research area of interest, and where we are looking to go in the future. So we are interested in this concept called, and this is sort of the central feature that underlies a lot of the research we do in the PACT lab, called cognitive bias modification for interpretation. So we know that people think differently when they're emotionally dysregulated. Our lab is particularly interested in how people think when we're anxious, so we also do some studies looking about how people think when they're emotionally dysregulated in the context of depression or loneliness or suicidality as well. And generally, we're really interested at trying to understand how we can shift this thinking to reduce negative mood and improve functioning. And if we can do that in a way that increases access to care, all the better. And sort of the third line of research in our lab is how we can detect periods of anxiety, depression, loneliness, but especially anxiety in real world contexts, and help people where and when they need it the most. So we've used a lot of methods to do this over the years, but most recently we've been interested in digital interventions based on the computer, based on phone, based on tablet, and also via mobile sensing. So whether we can use things like smartwatches and phones to sense people's heart rate and social situations to understand how they're feeling in a given moment. And kind of further on the line, we're interested in integrating these lines of research into something called just-in-time adaptive interventions, or JEDIs, which is the idea of kind of using people's real-world dynamic data to predict and then intervene in moments of anxiety in particular. And the way we do this, so my advisor, Dr. Bethany Teachman, a little over a decade ago, developed this program called the Mind Trails Project. It's a free-to-use online program that uses cognitive bias modification for interpretations to help anxious adults kind of think in different and more flexible ways. So as I mentioned, we know that anxious folks already have a tendency to take ambiguous situations and kind of approach them as if they're threatening or negative, when in reality they could be neutral or positive. And CBMI basically involves teaching people to kind of, again, think in this sort of different, more flexible and positive way. So a bunch of us, as you can see down below, there's about 5 different grad students that work on various iterations of this project, which I'll talk about on the next slide. And sort of our main goal with this project, of course, is to reduce anxiety, but really importantly, a core kind of value of our lab is increasing access and engagement through a variety of different methods. So we have a team, Taylor, Emilu, and Valentina. Taylor's our grad student, and Emilu and Valentina are 2 fantastic undergraduate students who've been working on a Spanish language translation of the online Mind Trails teen program to make that accessible to Spanish-speaking communities across the globe. I should also mention that Mind Trails is used in over 50 countries across the world, which is pretty cool. The web version, and has hundreds of thousands of users. And then we are also working on an adaptation of the program with Jesse Gibson and Susie Protea, 2 of our collaborators who are working on Mind Trails in the context of movement disorders. And then we also have an app version of Mind Trails that one group, Caitlin Petz and Emma Toner, are working on adapting a version for college students. And then I am leading a project in which we've adapted and translated Mind Trails Teen to an app for teenagers. And I should say that my line of research is especially interested in sort of combined an integrative care delivery of Mind Trails. So I've looked at whether or not we can deliver Mind Trails through primary care centers, working with Kaiser Permanente, and currently I'm looking at whether or not it's feasible to deliver Mind Trails teams through mentoring programs across the United States. So as I mentioned, sort of the line that we're working on right now is sort of combining all of these 3 things. So taking the Mind Trails intervention and applying it as a just-in-time adaptive intervention in the context of mobile sensing. So understanding that's sort of the line of logic that Max Lorazepal and Noah French and Tanvi Laktakvia are all working on now, is trying to see if we can use these devices to sense people's anxiety throughout the day. And then, as I said, we're also interested in how we might integrate this with healthcare systems to help give physicians and other care providers real-time health data, and just patients as well, a better understanding of how sort of, we can intervene on their symptoms, but also how their symptoms are informing other avenues of care. And the last thing I want to mention is that UVA recently got a really big and wonderful package of funding to start up this program called Thriving Youth in a Digital Environment. So I myself do a lot of work through this. It's essentially a large program that's interested in understanding how youth interact and exist within a digital context. So we're hoping to launch a number of studies in the coming years looking at sort of youth social media use, youth digital technology use, and how all of this can be related to our ongoing projects. So looking forward to answering any other questions that you guys might have later on.
Thanks, Emma. Okay, we can transition to our next presentation.
Maybe my turn, right?
Yes, thanks.
Okay, I will share my screen. And so, yep. Hi again. My name is Daeun Yoo, and I'm in the University of Washington Digital Youth Lab and KISS team UW. So as you can see, my advisors are Dr. Jason C. Ip and Dr. Katie Davis, and they have specialties in child-computer interaction. So in the under sub-theme of the human-computer interaction, there are some sub-community who research on children's mental health, emotional well-being, also how they interact with the technology, and how society or the parents or the school should make some better and healthier environments for socially supportive environments for the children's. The children's means not only very young age children's, like age between 7 to 12. We also research with the adolescents and also emerging adults. So our lab conducts work with the community organizations across the Seattle area, including the Seattle Public Libraries, Seattle Public Schools, Children's Hospital, local preschools, and the museums and libraries and more. So what we do is we are the group of the researchers coming from the diverse UW departments, such as not only University of Washington's Information Science School, there is the Department of the Human-Centered Design Engineering, and there is the Department of Computer Science, and also the Department of the Psychology or the Psychiatry. So all of these PhD students and professors are meeting on a regular basis to discuss about what we are studying and what we need to study, and also conducting lots of the collaboration in these kinds of interdisciplinary environments. In addition, we also learn some co-design session with teenagers and young children, and I think this is really interesting parts that we have. So for example, Youth Advisory Board, they are aged between 13 to 17. And 20 high school students meet with our UW researchers on a regular basis to share their expertise and perception onto the specific technology or their everyday lives, so that we can not only learn, but also design some solutions with them, not just imagining them. So for example, we are doing research with them how the technology impact their early childhood developments and how they perceive the current technology, what are some positive and negative impact for them. And also we design some solutions with them based on the learning sciences. And another good thing that we have is we invite these 7 to 11 years old children twice a week on a regular basis. And we are designing the new technology for children and with the children's. So this is different from the treating them as a tester or the informants. So we designed some solutions together, and they use the solution that we developed, and they shared a lot of what they like, dislike, or wish for their preference. And also, this is one of the app that I developed. So children, not only children, but also their parents are invited to University of Washington and use this together and share their thoughts, how this can make some good impact or negative impact on their everyday lives. So, and one of my core research area is I'm designing and building the socially emotionally supportive AI for children's emotional well-being through multi-human collaboration and the creativity. So as I introduced a brief, I majored in art and design. And when I studied, and not only studied, but also whenever I have some like depressed symptoms or anxiety, I always go to the museums and appreciating arts. And those kinds of some personal motivation makes me think about what if technology can help people to aware their emotions and regulate their emotion through the creative activities. So I conducted the clinician interview with the psychotherapist or psychologist or therapist regarding how they perceive the using the visuals and narratives in the children's emotion regulation. And based on that, I developed the generative AI supported creative emotion regulation tools. And then with this kinds of some prototypes, I've also already did this like a co-design session with the youth advisory board, and I could learn how they perceive this kinds of approach and what some features they wish for the future. And based on that, I am partnering with some postdoc students at University of Washington's medicine and psychology departments to make cognitive behavior therapies intervention more approachable and more creative ways. To summarize, not only me, but also many students in University of Washington Digital Youth Lab, they conduct co-design sessions, interviews, and experimental design with children's clinicians and parents. So we aim to understand the children's clinicians' parents' perception, and we expand some effective theories, not only from the psychology, but also from learning sciences or the core some human-computer interaction academia. And then we build emerging technologies using like a generative AI, VR, AR, whatever, which can deal with their needs and support and expand existing technologies. So yeah, we are doing this. Yeah, welcome if you have any additional questions, and thanks for listening.
Thank you so much for that wonderful presentation. We now invite our presenters from Dartmouth College.
Hi, I can share the slides, Yama.
Sounds good.
All right. Is everybody able to see the slides? Awesome. Yeah, so I guess I'll get us started and Yama will jump in. Hi, everyone. Like I said, I'm Sukriti. I'll be doing this presentation with another student in my lab, Yama. We are in the AIM High Lab, which stands for AI and Mental Health and Generation in Digital Technologies under Nicholas Jacobson, and we are at Dartmouth College. So yeah, just a little bit about AIM High. We are really looking forward and trying to understand sort of innovations in technology-guided healthcare, just like the rest of us here probably. And so we just wanted to, yeah, give a little bit of a background in what particular studies and projects that we are looking at. Our lab is kind of more heavily in the quantitative side of analysis and innovation. And so you'll kind of see that as a major theme. A lot of the methods and things that we use are along the lines of machine learning, deep learning, and large language models. And so, yeah, with that, can get a little bit into our mission. Yeah, this is just kind of straight off our lab website, but we are looking to do these things in particular. When it comes to assessment, we're looking at really trying to understand precise measurement and personalized assessment of things like anxiety and depression, but also other mental health disorders as we sort of expand our reach into sort of the full spectrum of mental health. And one area that our lab and our PI, Nick, in particular, is really interested in is using intensive longitudinal data. So our studies and our interventions are use quite intensive longitudinal data with multiple time points per day per participant. And so, yeah, along those lines, we typically do conduct these sort of multi-method assessment using particularly passive sensors from things like smartphones and wearable devices that enable us to collect this really intensive longitudinal data. And so with that, obviously, like I said, comes that scalable and personalized technology. And along with that, the analysis of those sort of really intensive data comes these kind of more complex computational techniques that we're also really interested in. So I'll talk a little bit about the studies and then I'll hand it over to Yama for the projects. A couple of the studies that our lab has done and is currently sort of conducting right now. In the past couple of years, we actually just wrapped up this pretty big R01 study called the Tracking Depression Study, which took place over about 3 years. We collected data from about 300 participants in which they filled out EMAs, which for those who don't know are just questionnaires on their mental health that participants filled out 3 times a day for 90 days. So again, kind of going back to that intensive longitudinal data collection. And so from that, we got a bunch of different type of data from the smartphone and from watches that participants were using. And it's been really interesting to see that sort of first big study in our lab really come to fruition and be really interesting. One of the studies currently ongoing in our lab is called the Sensing Schizophrenia Study, which looks obviously, as the name suggests, at populations with schizophrenia, again, using passive sensing techniques from smartphones and a very similar sort of setup to our Tracking Depression study, and really sort of looking at monitoring symptoms throughout time and seeing how we can model those in our analysis post-study. A big part of our lab is actually centered around a generative AI powered chatbot, which we have called Therabot. I'll talk about a little bit more about that in the next slide. So I'll let that be for now. And then we have some student wellness projects as well with Dartmouth students, which Yama knows more about. So I'll hand it over to her.
Yeah, I can talk a little bit more about that project. So we already built the Therabot and now we're working on like a university-wide like it's a multi-collaboration between like computer science and our program and also CTBH, the Center of Technology Behavioral Center. So the goal was to develop like a Gen AI chatbot for the undergrads to support their mental well-being. So there will be a lot of, it's just at the beginning, but they have planned for like 2 years and now we're just like getting to work and start working on like a different research on this big project. But that will be like last for like at least 5 years for the next couple years. So I'm going to talk a little bit more about like the projects and like the methodology we use. So I think we heard like Cheetah in like earlier presentation. So we're also trying to like design like intervention to provide the right amount like of dose like at the right time and can be adapted to individuals changing internal and contextual states. So we are using a lot of passive sensing sensors like phone or like wearables like Fitbit or like different like Apple Watch, and to collect like data and to identify and using different model to identify the best timing for intervention. So that's one big part of our projects. And yeah, that kind of covered the second part. And the methods we're using in our lab is mostly, it's very quantitative. So we use a lot of machine learning and deep learning techniques. And we also use a lot of large language models. And also we study a little bit about the network science, and we use a lot of EMA data, ecological momentary assessments to so with all these methods to collect the intensive longitudinal data for analysis. So yeah, we can go to the next slide.
Yeah, so I'll talk a little bit more about Therabot here since we've been getting a lot of really positive media attention and have been fortunate enough to have the primary article and data from that trial published in the New England Journal of Medicine. As you can see here, is a pretty big team, but generally what Therabot does is and what makes it so innovative is that it is powered by generative AI and not rule-based AI. And so with that, it's able to be much more tailored to mental health treatment in particular, but also each user as they need to come. And so that it kind of gets at our overall lab goal of really wanting to have these personalized sort of assessments and also adaptive interventions, since Therabot is sort of supposed to be deploying interventions digitally at its forefront. And so you can feel free to ask us questions about that in the break room, but just wanted to plug our lab a little bit more here. We were again fortunate enough to be on the front page of the New York Times with this innovation, and yeah, our lab is looking to expand a lot more on Therabot as well in the coming years, since LLMs, which is what fuels Therabot, the generative AI part of Therabot, is a huge thing now, but we foresee it being a much bigger sort of tool to be used in the future, especially within digital mental health. And so that's Therabot. And then I thought Yam and I were thinking we would just give some thoughts about our own experiences in the PhD application process. And I can talk also about my experience with my actual thesis work as we go on. But yeah, Yama, if you wanted to say something about your...
Yeah, I think maybe we can talk more about this in the like breakout room later, but as I have a background in clinical psych and data science, I can share a little bit more about like for folks like who's interested in clinical psych PhD, but I was also trying to find like more labs that's doing like digital mental health, this kind of multidisciplinary work. I'm happy to share how I pivot from clinical side to a lab that's working on digital mental health, but I also have a clinical side perspective. Like, I'm happy to talk more about this in the breakout room and take any questions. And yeah, I can also talk more about like my experiences in the lab, and Sukriti can talk about the clinical experiences.
Yeah, I think like just in general, just to touch on my research in particular, while the lab overall does work with, like we just mentioned, a lot of digital mental health tools, we have a lot of flexibility with what our actual students work with. And so I actually work particularly in eye tracking and different linguistic methods using NLP and LLM techniques. Again, very computational and also software heavy, but as somebody who is actually looking more towards the industry, these are sort of skills that we also are very fortunate enough to cultivate in our lab. And so, yeah, open to answering any questions in the breakout room.
Thank you so much. We will now transition to our final speaker from San Diego State University, and then we'll be moving into our breakout rooms after that.
Hi, my name is Tori. I am from San Diego State University, working under the guidance of Dr. Silvana Vargas. I have a short little slides of just what our lab does and everything. So I'll go ahead and share my screen really quick. Okay, so thank you guys for having me. I'm super excited to talk about what we do in our lab. So we at the Collective Lab is a newer lab at San Diego State University under the guidance and supervision of Dr. Silvana Vargas. And currently our research focuses on digital mental health for teens that utilize teen helplines. And our main question is how can we adapt and implement evidence-based practice? And in our case, motivational interviewing for helpline advisors to provide more efficient services to their users. And before I start talking about what specifically we do in our lab, I just want to start off with the basics so everyone just has some context. So what is a helpline? A helpline is a service where volunteers are able to give non-judgmental support for the users or callers given situation. And these services can be provided over a call, text, or even email exchanges. And the helplines that we're working with are two Los Angeles-based hotlines that focus on digitally supporting teens across the United States, encouraging those teens to seek help in their real lives, and then encouraging them to speak to their parents about what they're going through, a teacher, a school counselor, or even encouraging professional support like a therapist. And so there are different stakeholder groups that we're working with across both helplines. One being the teen helpers, the ones that are responding to users who are under supervision. The second group are the supervisors, who are the ones supervising and providing support for the teen helpers. And finally, we have the leaders and trainers who are providing the training to the teen helpers. And a couple more things I wanted to touch on really quick was motivational interviewing. So I just wanted to give it like a very brief explanation and overview. So motivational interviewing is an evidence-based practice that is used to encourage one's motivation for change. And the teen advisors that are working under these helplines are only given a very broad overview of motivational interviewing in their trainings. And I just wanted to give a couple of examples of the qualitative work that we're doing for analysis. And we're just specifically looking at their interactions via text messages and collecting data through focus groups and interviews. And so starting off, we have a handful of projects going on, but all the ones I'm going to be talking about right now are going to be relating to our big picture teen helpline project. So the helplines that we're working with are, again, a Los Angeles-based hotline. And one thing that we're working on is coding. So one of the helplines that we're working with is an application specifically that you could like download through the App Store or like Google Play. And so what we were doing is reading their past posts and seeing how much motivational interviewing that they're already using with users. And we're coding this through a codebook called the Mighty. And another thing that we're working on is qualitative analysis of previous focus groups that I've done with different stakeholders of the same teen helpline. And in these focus groups, they were with teen advisors, supervisors, and leaders, where the focus of these focus groups were to gain their perspective on their training needs and their experiences at the helpline. And then our final project under our big umbrella teen helplines project, we are currently recruiting and conducting focus groups with stakeholder groups from a different teen helpline, where these stakeholder groups consist of teen advisors, supervisors, and trainers. And the purpose of these focus groups is similar to the ones that we've previously conducted and ones I just talked about, where we're interested in their perspective on their training needs and their experiences at the helpline. And our final big picture project is our user engagement project. And with this, we're looking at recruitment strategies and looking to see what are the most effective strategies when recruiting teen participants who are specifically users of teen helplines and how to maintain the retention throughout a study, especially being done digitally. And in regards to our next steps, we're just hoping that we can use human-centered design to develop a targeted motivational interviewing training for team helpers and incorporate AI to help facilitate training at scale. And we're using AI to support several implementation strategies to try and improve the use of MI and helplines. And that was basically it. It was really short, but yeah, if you have any questions, you go to our lab website right here, and then also in the break rooms, like if wanted, like I can also share my email too. But yeah, thank you.
Perfect. Thank you so much. The breakout rooms are open, so please feel free to hop in and out however you see fit, get some questions answered, and I will be in the lobby just for extra support. Perfect. And Emily, I created one for you too, just in case Tori needs to hop off early.